Good afternoon. Welcome to day 345 at the EMA office, where we bring you the latest and the numbers for the COVID. Here with Chairman Mark Kern, and today, Mila, we let you escape from the vaccination site to come in today.
Yes.
Good. We appreciate it.
Well, good afternoon, everybody. So today we have 54 new positive tests out of a total of 1,199 for the day. The age range of those individuals were in their teens to in their 90s, and 25 of those individuals were under the age of 40. The county positivity rate is at 4.5%, with a 7-day rolling average at 6.2%. The regional positivity rate as of February the 18th was at 4.4%, and I'm happy to announce we have 0 new deaths for today. Countywide, we have conducted a total of 278,901 tests. That consists of 27,626 positives and 251,275 negatives. The total number of deaths to date is 442, and our condolences go out to those families. To date, the number of individuals who have completed their 10-day isolation period is at 26,500. Statewide, we've tested a total of 17,622,800. Total positives were 1,174,409. That's an increase of 1,585 since yesterday. Total deaths to date is 20,269 for the state, and that's an increase of 35 since yesterday. For St. Clair County hospitalization numbers, we're at 74 for total number of COVID-related hospitalized patients, and regionally we're at 109. Patients on ventilators for the county is at 5, and regionally we're at 12. We have no new additions for outbreak congregate care status today, and I do want to remind people to not forget about testing. We want to still have people go out and test to know your status. We have multiple locations in the county where that can be achieved, and the St. Clair Square Mall is one. They're open Monday through Sunday from 8 to 4. We also have Med Express, the Cahokia Walgreens, and so there's lots of options out there for everybody. And Chairman Kern?
Thank you, Molly. Yeah, numbers are looking better, but hospitalizations in the county did go up a pretty good amount over last night. So it's still out there, and getting tested is still one of the best defenses we have, along with washing your hands and wearing the mask and watching the social distance. So
And getting vaccine when it's your turn.
that's the key, Mila, and you're doing a great job at that. We sure appreciate it very much. Okay, let's look at the zip code report. These zip code reports are getting shorter too. That's a good sign. In 62206, we're up 2 today to 1250. 62208 up 6 to 1554. 62220 up 2 to 1965. 62221 up 6 to 2652. 62223 up 2 to 1663. 62226 up 6 to 3038. 62232 up 3 to 860. 62239 up 1 to 435. 62243 up 2 to 729. 62254 up 1 to 780. 62258 up 2 to 998. 62264 goes down 1 today to 344. And 62269 goes up 2 to 3,121. We heard about the positives today, 54 new positives in the county, 1,199 people tested, brings our county positivity down today to 4.5%, which in turn then brings our rolling average down to 6.2%. Regional positivity is up a little bit today, but it's up to 4.4%, so that number still remains pretty good. Bond County comes in at 3.5%, Clinton County 1.6%, Madison is 6.2% today. Monroe is 3.2%. Randolph is 4.1%. St. Clair, 2.7%. And Washington County comes in at the bottom at 0% today. So good job, Washington County. Herb, question answer day?
Numbers are looking good, questions and answers today, and we'll call this the Mila Show today. Seems like all the questions are directed towards you. Brian?
Okay, Milo, the first question came in, says, what percentage of people need to be vaccinated to stop the pandemic, such as herd immunity?
So there's a lot of information out there that you can read up on, and the simple answer is that we don't know yet. We don't know how the vaccine's going to perform in the population over time. And when you look at that, you also look at total immunity, people who have naturally acquired immunity versus receiving it from the vaccine. So there's a lot that goes into that, and you can look and say 70 to 90%. But I think the simple answer is that we don't know yet.
Okay.
CDC has some good information out there.
Okay, lots of questions on this next topic, but we'll discuss it here. On February 25th, will you be making the vaccine available to the updated Group 1B Tier 2, which includes those with underlying health conditions?
Yes, that's the plan, or maybe even before then, it depends. When we start to see a lull in our appointments being taken up, it's usually a signal to us that we can move groups in concert with state guidelines.
Okay. The next person says, if I was in 1B and canceled my appointment, will I be able to schedule it in a month or so?
Right. I would encourage you to call the call center. We now have the call center operating 7 days a week. That number is 618-825-4447. They can assist you with that.
Next person says, how soon before you're due for your second dose will you be notified to schedule it?
Like we try to get the information out there. Wherever you receive your first dose, we encourage you to go back to that entity to get your second dose. For the health department, we schedule it out in 2 to 3 days. We'll send you a reminder so that you can go on and register yourself for an appointment.
So 2 to 3 days before they're due for the second dose
That's
is
correct.
when they should expect to see.
Right, and so and you'll get a text or an email that says this is for your second dose. So we've had that some people are on multiple lists, and so they're getting multiple notifications to register for vaccine, and that would be your first dose. So again, the ones that we send out will specify second dose.
Okay. The next person says, I received my notification for my second shot, but I mistakenly booked before the required 3-week time frame. I canceled the appointment and re-signed up under the normal portal. Will I be recontacted to book my appointment for the appropriate time frame? And if I'm not notified, who should I contact?
So again, you should receive a notification if you received your first dose with the health department just a few days prior for your second dose. If not, you can call the 825-4447 number.
And Mila, there is a different time period if you got Pfizer vaccine or Moderna. Can you just reiterate what that is?
When you received your first dose of vaccine, you should have received a CDC vaccination reminder card. And so it'll designate whether you received Moderna or Pfizer. So for Pfizer, it's a 21-day wait before your second dose, and for Pfizer, it's a 28 wait. So all your information, including the lot number, is on that card. Now, if you don't have it, we can look it up in the system when you come, and you'll get that reminder, so it should be in line with the timeline that you need to wait.
In Miley, it's okay if that 21 or 28 days, they go beyond that, they just can't get it before that.
Sure, you should wait till at least that time period, the 21 or the 28 days, and then anything beyond that is fine. We just ask that you not try to schedule prior to that time frame.
Well, and we had some issues with that. There's a couple questions popping up now. So the first notices went out about 7 days ahead of people doing for second doses, and we saw people signing up
Right.
too early for their second dose. So that's kind of why the modification's being made now, that it'll be 2 to 3 days before their second dose
Correct.
when they'll get that notification.
Right, because we don't want people coming too early.
Okay. The next person says, my husband will be on antibiotics after a dental procedure. We got our first shot on February 6th, and he will still be on the antibiotic for our second shot. Is that a problem? Can he still get the shot?
It's not a problem. He can still receive his second dose as long as he's not ill at the time.
Okay. The next person says, after I have got a time verified for my second vaccine, will I get a text message with a QR code as I did the first time?
Right, so the process is the same. You'll receive the email for you to follow the link and register, and then you'll get the QR code. As soon as you hit the submit button, you'll get the text message with the link to the QR code.
Okay, the next person says, as I understand it, effective February 25th, residents 16 to 64 with medical conditions will be eligible to make appointments for a COVID vaccine. Does the resident need to present proof of their medical condition, or how will that condition be verified to ascertain that they do have a legitimate health condition?
So when you go through our registration process, there's a series of questions that you self-certify for, and that's the attestation.
Okay. The next person says, I should be getting my second shot, but I heard there might be delays on second shots. Are we running on schedule, or is there a shortage?
So with everything, it's as vaccine is available. We don't hold second doses back. The state is supposed to be scheduling and sending those, and to date, we're not having any issues with that.
The next person says, my daughter is 38 and has an autoimmune thyroid disease. When she gets sick, she gets really sick. What group would she be in, as there is no place for autoimmune disease issues?
Right. So that's correct. When you read through there, it doesn't address autoimmune. So the current mass vaccination plan for the state is the 6.0 version, and I believe the St. Clair County EMA has that out on their webpage. I would encourage you to look at the bottom of page 15 for the definition with disabilities. And if not, then it would have to, she'd have to wait out her time for her age group.
Okay. The next person says, how do college students get the vaccine if they are in part 2 of group 1B, specifically if they're at a school out of state?
Okay. So if that individual, is coming home, they would be eligible in our county once we make that move. But otherwise, if they're staying at the school at the other state, I would have them refer back to whatever the local policies are for their vaccination programs. It can vary somewhat by state, so they would have to be familiar with those protocols.
Okay. The next person says, why are people over 65 from other counties able to get a vaccine in St. Clair County when we are over 65, live in St. Clair County, and haven't been notified to get ours? It doesn't seem fair.
Right. So if you're over 65 and you are on our vaccine notification form, you should have received information on how to register. If that's not the case, go ahead and call that 825-4447 number, and they will be able to assist you with that.
Okay. The next person says, is it true that once you've had COVID-19 and you receive your vaccine, you are no longer able to donate your plasma to current patients?
You can't donate the convalescent plasma, and the different donation centers out there like American Red Cross have information on their website about that.
Okay. The next person says, I got my first shot on February 8th. Will I get my second before March 1st? Because I'm going to Mexico March 2nd for 15 days.
Well, it depends on what vaccine that you received, but you should be receiving that notification, depending on which one you received by that time frame. You can call ahead and you can try the 825-4447 number if you like.
But of course, just because you get that second vaccine, you have to wait to become, if they think they're going to be totally immune when they go to
Right.
Mexico, it takes a period of time before the
Immunity is achieved.
the second dose gives you the immunity. So just remember, just because you got a shot, whether it's the first one or the second one, you still have to wait those time periods to be able to get that ultimate immunity that you're seeking.
Correct.
Okay. The next person says, why aren't hairstylists included in early vaccinations?
So those guidelines are dictated by the federal and state governments. So again, we're all following the state guidelines.
Okay.
And I will say that as we move through the phases, ever so often they release a new version of the state immunization plan. So again, refer back to that. Right now we're at 6.0. We would expect within coming weeks to have another version, which would further qualify out those 1C phase 2 people who are eligible. So keep your eye open for that.
Okay. The next person says, I have read that all vaccination sites are to have an antidote on site in case of a reaction. What is that antidote? I've also read that 166 people died due to taking the vaccine. How many people in Illinois or St. Clair County have had a reaction that required them to go to the hospital? I'm sure I'm not the only county resident that would like to have this question addressed.
So the paramedics use a combination. They can either use Benadryl or epinephrine, similar to the EpiPen that some people have. And again, it's at their discretion. I've talked to some of the EMS locally, and to date, to their knowledge, we've not had anybody that needed to be administered that medication or be taken to the hospital. When you do receive your vaccine at the vaccination site, you'll receive information on how to report if you just have any different types of reaction to the V-Safe program through CDC, so I would encourage you to do that.
And for people who haven't been there to the site or been to any of the sites, you have to wait 15 minutes and 30
Right.
minutes, at which point you're monitored and there is an ambulance there just in case there would be a reaction. But
Right.
so far, it's been it's been pretty smooth, been pretty rare that anyone feels something when they get that shot.
That's correct. And, at the Mass Vac site, we have different lots for people to pull in based on your health history. That's why it's important that you really read through that and, to give us accurate information so that the medical professionals can make the determination whether you should wait the 15 or the 30 minutes to be monitored to make sure that you're not leaving and then having a reaction.
Well, and it's set up to where in those 15 and the 30-minute lots there are, as you said, the EMS people are out there monitoring, the National Guard. It's not like they're just sitting out there in a car. So it's really well thought out, and safety is what we're all talking about.
Right. At the Mass Vac site, we have roaming paramedics as well as 2 ambulance stationed there at all times.
Okay. The next person says, I have signed up a dozen times. Why have I not gotten a code to get my shot? I'm 70 years old, a thyroid survivor, and have health issues.
You should have received a code by this point in time. So again, you could check your spam, but I would just go to the 825-4447 number for assistance.
Okay.
And Brian, we want to make sure we get that number put up for anybody who needs to call, can get it off the site.
Sure. The next person says, once senior living facility residents have had both vaccines, when will they be allowed to have family visit in person?
So IDPH sets those guidelines. I would refer you back to them and refer you back to the facility to see what their internal protocols are as well.
Okay. And the last health question that came in said, hello, great job everyone.
Thank you.
We were talking here and realized that we know people that have expired or might not even have an ID at all. I imagine there could be many like this. Would these individuals be left out from getting the vaccine?
No, you can bring, if you have an expired ID, you can bring that in a current piece of mail. What we're looking for is to verify that you're an Illinois resident or that you at least work in St. Clair County.
Okay, thank you, Mila. Chairman Kern, a question that came in for you says, last year the governor said phase 5 would be possible when we had a vaccine, but now we're having to wait until most are vaccinated. I find this disappointing.
So last year, long time, and the pronouncement that was made when we went into the phases was basically when we get enough immunity out there to where we can reopen these large-scale events, which really is what now is in that next phase. I mean, we are all gonna have to be somewhat immune, or at least a good portion of us are gonna have to be immune. So when you have these large events, you don't have breakouts anymore of these spreads that we were used to last summer, or at least used to reading about last summer. So it's basically just all about immunity. When those phases were put into effect, you really didn't know how effective the vaccines were going to be. The stories are better and better about Moderna and Pfizer and the efficacy of those vaccines. So we just continue to move into the Johnson & Johnson phase, and hopefully, we're starting to see the world talk about opening up. Baseball season, spring training is going on right now. We really see light at the end of the tunnel, but we have to keep these numbers down. We got to keep doing all the things we're doing until, and we encourage you to get that vaccine. I know there was a question saying there were all these problems, but I know a load of people who've been vaccinated and have not seen any problem. They feel it's safe. Everyone is saying it's safe. You can look at everyone from the President of the United States, the Vice President of the United States, to a lot of public figures that have received the vaccine. They're all doing well. A lot of the local clergy in the county stood up and went in and got vaccinated so that you would have a comfort level to see someone who had gotten the vaccine. So I would just say that we're trying to get this immunity out, and once it's there and once it's taken hold in the community, we'll be able to get back to where we want to be in that phase 5. There is no way that the governor doesn't want everything to be open. It's just it has to be done safely, and at some point in the fairly near future, we're going to be there.
Yes.
Director Simmons, one question that came in here for you says, is there a way for individuals to show their thanks to the fairground workers and volunteers? Something like donuts, snacks, beverages, but I do understand it would need to be a commercial facility.
Yes, that's correct, and we appreciate that offer. There's been several of the businesses and individuals that have stepped up over the last several weeks. We've been trying to provide a meal for the National Guards and our medical staff on Fridays. So if there is someone out there that wants to do that, they can contact us here at the EOC, and I will put them in touch with the staff to arrange that. And it's really been overwhelming that some of these individuals and businesses that have stepped up to show their gratitude. So we appreciate all the help that we can get there.
So,
Anything else? Okay, so remember, if you haven't signed up to show your interest in getting the shot, you can do so. As of today, 86,287 citizens have done so. That's 842 since yesterday at this time. That's the first start of it. And again, Mila, thanks for all the work that you're and your staff. And there's a lot of people behind the scenes that
Right.
don't get that credit as we talk about, the people back at the health department, both at St. Clair County and Eastside Health District. It's a teamwork,
Exactly.
everything. It's from the highway departments, PBC.
It's a community response.
It's
It really
community.
is.
It's Team St. Clair. I mean, sharing this briefing with your neighbors and friends and getting the word out there, telling them to get vaccinated is what we need, as the chairman said. The light is getting brighter at the end of the tunnel, and we said that all along about our tunnel. We do have a tunnel at the back. Come in one end, go out the other, and the light's getting brighter, and it's really great that Team St. Clair is pulling, all the horses are pulling in the right direction. So we'll be back tomorrow with day 346. We don't have Cindy with us today, but we'll be back tomorrow afternoon with another briefing. Thank you.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.